And okay.
Thank you.
I have to upset the registration. Okay, sorry. And thank you again, Chun-Lin, for your very kind presentation. The pronunciation of the Italian words are perfect. So don't worry, it's perfect. Much better than my English. Sorry, but it's another story. Okay, I start sharing my presentation. Okay, it's okay?
Yes, we see.
Okay.
Yes.
So, as Chun-Lin has said just a few seconds ago, my presentation will be focused on the use of polysaccharides in drug delivery, and specifically in polysaccharide nanohydrogel. This is a special form of polysaccharides and a special form of hydrogel. And I would like to try to demonstrate how it is possible to use this kind of delivery system for different therapeutic applications. But before starting my presentation, I would like to remember you that you can find on the web the research lecture given by Martin last time in the webinar, and he delivered a very nice talk about nanoparticles based on hydrophobic polysaccharide derivatives for application and characterization techniques and so on, and for the biomedical application. And my presentation is focused on polysaccharides derivatives, hydrophobic polysaccharide derivatives that can be exploited to form drug delivery systems. And I would like to show you that it's possible to merge 4 keywords in order to obtain useful devices for drug delivery. 4 keywords are hydrogels, of course, nanoscale, polysaccharides, in particular hyaluronan and gel, and that are the 2 polysaccharides that I use in my lab to set up different systems, not only for drug delivery, but also for tissue engineering applications. But this is another story. And they can be merged to obtain a very versatile and efficient system. Hydrogels, the first keyword is hydrogels. All of you know very well what are hydrogels. Hydrogels are exploited in food, of course, are exploited in the personal care, and you can find a huge number of devices that can be used for the personal care. For health and wellness, all of you knows very well what are contact lenses, or what is the systems that can be used for aesthetic surgery, or for the viscosupplementation in order to reduce the pains at joints. But hydrogels can be used also as commodities. Many people, especially people that are affected by neurological diseases, have a huge problem in drinking water. So recently have been developed medical devices that allow these people to drink by eating. So simple carboxy methylcellulose, 10%, more or less 5–10% in water, give very polysaccharide and give hydrogels that can be easily eaten by these people. And of course, hydrogels are used in pharma applications. There are a lot of pharma products that are based on hydrogels for wound healing, wound dressing, as drug delivery, depot drug delivery systems, for intravitreal injection, transdermal patches. So you have a very wide range of medical, of pharmaceutical products that are based on hydrogels. What are the advantages of the hydrogel? The advantages are related to the high water content. So you have systems that are very similar to natural tissues. They are generally biocompatible, biodegradable. They have good transport properties and can be injected. And moreover, recently there have been developed a lot of hydrogels, smart hydrogels that are sensitive to external stimuli like pH, temperature, solvent, and so on. So hydrogels can be a very useful tool in many fields and many field of applications. The second keyword is nano. I show you this slide just to remember the two most important people in the nano world, Richard Feynman and Eric Drexler, that coined the term, that founded the nanotechnology era. Then there are a lot of there are a huge number of nanoparticles, from liposomes to metallic nanoparticles to SLN and so on. And the main features of these nanoparticles are the possibility to control the drugs at target sites. You can exploit nanoparticles because of their reduced dimension to target specific sites, not only specific cells, but also specific sites in the body. They can protect drugs from the degradation. By using nanoparticles, you can reduce the toxic side effects of many drugs, especially the anti-tumor drugs. And just to remember the targeting effects, you can have an active targeting by modifying the surface of the nanoparticles by using specific ligands that are able to interact, for example, with receptors that are present on the top, that are present on the top of cells in order to have a specific interactions. And there is, besides the active targeting, there is also the passive targeting. The passive targeting is a specific targeting effect that is based on a different structure of the epithelial cells that are present on blood vessels. And when you have a tumor vessel or inflammatory tissues, the blood vessels are a different permeability towards substances, and in particular, you can introduce in the blood vessels nanoparticles, and in tumor vessels, for example, you have a larger diameter, an improved permeation of the epithelial cells. So nanoparticles with the right dimension can flow from the bloodstream to tumor vessels, whereas in the normal tissues it is not possible. So in this way, you can target nanoparticles in tissues that are affected by tumor or inflammations. And there are some products, pharmaceutical products that are based on this, on nanoparticles, and that can exploit this effect, the passive targeting. And among the different nanoparticles, there are also the nanogels. What is a nanogel? Nanogel is an hydrogel at nanoscale. And there is a wide range of polymer and fabrication techniques that are able to control properties, shape, and size of these nanogels. And the presentation that I told you that was given the last webinar, this point is largely faced. And the problem between commas of this kind of delivery system is that it is very young, because the first nanogels were recognized and developed more or less 20 years ago in the so-called nano age, starting the so-called nano age. And how is possible to obtain nanogel? There are a lot of techniques. The technique that we use in my lab is the self-assembling of polymer chains. And how is possible to do it? Starting from a polysaccharide, that is usually a water-soluble polymer, you can derivatize the polysaccharides by means of hydrophobic moieties. In this way, the polymer chains are not anymore soluble in water. They have a different, they can swell in water, but are not any more soluble. And by using special techniques, you can transform the polymer chains, the raw material, in nanoparticles that are based on stacking of the hydrophobic moieties that are cross-linked by the polysaccharide chains. And as you can see, that is the general recognized model. You can have in the nanogel a part that is more hydrophobic, the stacking part, and a part that is hydrophilic. So the nanohydrogels, based on the self-assembling process, have like a double nature, hydrophobic and hydrophilic at the same time. In my lab, we do today, and I hope also in the future, these nanogels, we produce the nanogels by using gellan and hyaluronic acid or hyaluronan, that are two well-known polysaccharides. And as hydrophobic moieties, we use prednisolone, cholesterol, and derivatives of the riboflavin. And it is possible by using a combination of these systems, it's possible to obtain nanoparticulate drug carriers at nanosites drug carrier with a high water content, high biocompatibility, and also mucoadhesive properties. But how it is possible to produce the nanogels? So what is the self-assembling process? What is this self-assembling process can be based mainly on three different procedures. The first one is the well-known nanoprecipitation process. You can drop a solution of the polymer in a non-solvent system in order to obtain a precipitate. The second one is based on the ultrasound, and the third one is based on autoclave. This system is not is a new one. We patented this effect. What is the process? You can put the polysaccharide in autoclave, and at the end of an autoclave process, you obtain the nanoparticles. And here you can see the nanoparticles that have been obtained by using the autoclave process, cryo-TIM and IFA images of these nanoparticles. So by means of the autoclave treatment, a very standard autoclave treatment, you can obtain nanoparticles. And at the same time, of course, you obtain a suspension of nanoparticles that is sterile because of the autoclave. A second effect that we observed by using the autoclave is that you can obtain a modification of the dispersion of the nanoparticles dimensions. So for example, you can prepare nanoparticles by using a different method, and by means of the autoclave, you have a modification of the distribution of the dimensions of the nanoparticles. But more importantly, it is possible also to obtain nanoparticles with a drug inside by means of one-shot process. So if you mix drug and polymer in different combination, of course, depending on the polymer, depending on the drug, and so on, by means of the autoclave process, at the end of the process, you have nanoparticles with a drug that is directly inserted within the nanoparticles. And this is a very efficient method to prepare nanogels with a drug inside. Here you can find the nanoparticles that have been characterized, of course, and in dry conditions, in wet conditions, and we determine also the extent of water that is inside of the nanoparticles, the swelling effect, the swelling behavior, and so on, and also the Young modulus of nanoparticles. And but what I would like to share with you is that it is possible also to prepare through formulations. And we observed that it's possible to freeze-dry nanoparticles by using a suitable cryoprotectant, dextrose in this case. And after preparing the nanoparticles, you can add the dextrose and freeze-dry the systems. And at the end, you can recover the initial systems by adding water even after 6 months. And you have no modification of the dimensions of the nanoparticles. And it is an important point because sometimes through very interesting systems, nanoparticle systems cannot be exploited into applications because of their instability in long-term storage. And these nanoparticles, by using different approaches in producing the nanoparticles and loading drugs, have been demonstrated to be very versatile. It is possible to load within the nanoparticles hydrophilic drug and hydrophobic drugs. And probably the distribution of the drugs is in the water in the hydrophilic environment, and when you try to load hydrophobic drug, you have a stacking of the hydrophobic drug over the stacking point, the domains, hydrophobic domains. And we performed a huge number of experiments. We use small drugs like paclitaxel, anti-cancer drugs, antibiotic drugs, anti-inflammatory drugs, but also natural substances like curcumin, resveratrol, non-extracts, and so on. And finally, also proteins. And we observed that in many cases, in some cases, proteins have been destroyed by the nanoparticles because of interactions, but in many cases, you have the retainment of the activity of enzymes, for example, BSAO, alginate liase, and so on. But in my presentation, I would like to show you only the application with the normal, between commas, drugs and not with proteins. These nanoparticles are very biocompatible. We treated mice with a very huge amount of drug of 4.5 milligram per ml. And at the end of the experiments, all the mice were still alive, and the hematic and hepatic parameters of the animals were perfect after 24 hours, but even more. If you introduce these nanoparticles in the bloodstream, of course, you have a biodistribution of the nanoparticles. And for example, for hyaluronic acid, you base nanoparticles. There is the most of the nanoparticles are present in the liver, and you have a different concentration of the nanoparticles in the liver during the time, and at the same time you have a reduction of the plasma concentration of the nanoparticles. This graph is related to the hyaluronic acid. But when you transform the hyaluronic acid in hyaluronic nanoparticles, you have a different biodistribution. So you can see immediately that you have a different circulation of the polymer, of the nanoparticles in the bloodstream with respect to the hyaluronic acid. And more clearly in this graph, you can see that after 24 hours, hyaluronic acid is completely captured by liver, whereas you have no more nanoparticles in the plasma. But hyaluronic acid nanohydrogels have a completely different behavior, and after 24 hours, roughly half of the nanoparticles introduced in the bloodstream are still circulating. So it means that can be used, efficiently used for applications that are based on the passive effect. So in this way, we have done no experiments in this sense, but in principle, it's possible to use the nanoparticles based on hyaluronic acid for long circulating drugs applications, like, for example, tumors. But I would like to show you now some applications that we have done and some proof of concept that we have done with these nanoparticles. The first one is related to the application of gellan, prednisolone, and gellan cholesterol applications in the so-called dual drug therapy. What is the dual drug therapy? Usually, you know that all the drugs are based only on one drug, on one active pharmaceutical ingredient because of regulations and so on, but also because it's possible to modulate more the therapy against one disease. But there are some situations in which you can use the administration of two drugs in order to have a synergistic effect. And it is the case, for example, of the prostate cancer and some anti-cancer protocols in which clinicians administrate an anti-tumor drug and an anti-inflammatory drug in order to have a synergistic effect. But generally, they are administered in the same time by using different drugs that are mixed just before the administration. What we have done, we thought that it's possible to administer at the same time an anti-cancer drug and anti-inflammatory drug by using the same drug delivery system, in order to be sure that you have the same effect in the same cell, because you administer anti-cancer and anti-inflammatory drug exactly in the same cell. And for this purpose, we use the gellan gum, that is a polysaccharide based on glucuronic. We have a carboxylic moiety. We reduce, of course, it is necessary to reduce the molecular weight of gellan gum in order to obtain the right dimension of the nanoparticle. And by a very simple chemistry, we modified the prednisolone by adding a short chain, and by a simple reaction between the bromine and the carboxylic group of the gellan, we obtain the prednisolone derivatives, and we have done the same reaction by using cholesterol. And the nanoparticles that are obtained by using, in this case, ultrasound nanoprecipitation are very stable during the time, and you have also a zeta potential that is negative and is very stable also, this one during the time. It means that you have a reduction of aggregation phenomena of the nanoparticles. And we tested these nanoparticles by using different cell lines, fibroblasts, hermiblasts, prostate cancer cells, and so on. And these nanoparticles are very biocompatible, so you can administer at very high concentration these nanoparticles without any effect on the cell viability. But we observed that these nanoparticles are active, so you can have an anti-inflammatory activity by the release of prednisolone in the nanoparticles. So this is the reference, and when you administer the nanoparticles with prednisolone, you have a reduction of the TNF alpha. And when you load the paclitaxel within the nanoparticles, we obtain a very interesting effect on on cancer cells. So paclitaxel and prednisolone are able to act on the nanoparticles, on the cancer cells, and you have a reduction of the cell viability, the cancer cell viability, that is higher with respect to the free paclitaxel. So it means that you have really a synergistic effect. And I would like to skip, we tested with this effect on different cell lines, and with ovarian cancer cells, the so-called ESCO3 cell line, we obtain a reduction of the IC50 from 33, of the paclitaxel, free paclitaxel, we obtain 7.7 nanomolar IC50 of paclitaxel prednisolone. So it means that it is effective. So the dual drug therapy is possible by using this kind of drug delivery system. Another proof of concept is we have done is related to the antibiotic delivery. You know that antibiotic resistance, antimicrobial resistance is a very huge problem, and maybe in the next years we will have a lot of problems all over in the world because of the antimicrobial resistance. And one of the most important bacteria that is resistant to many antibiotics is the Staphylococcus aureus. Why? There are a lot of effects that are exploited by bacteria to resist to the activity of antibiotic, and one of these is the so-called intracellular escape. So bacteria escape the immune system and escape the antibiotic activity by means of internalization in cells. For example, macrophages and so on. And levofloxacin is a very potent antibiotic. It is completely ineffective against intracellular bacteria because there is an efflux pump. So levofloxacin is internalized by cells, but immediately is pumped out. And for this, it is possible to use the nanoparticles as a Trojan horse. All of you know very well this story. So we embedded the levofloxacin in nanohydrogels in order to treat cells in which bacteria have been embedded. Nanogels, levofloxacin alone and levofloxacin embedded in nanogels is not, you have no difference between levofloxacin and levofloxacin embedded in treating bacteria alone. This is the reference point, and here you have the effect of the levofloxacin embedded. So you have a reduction of the concentration of bacteria, but at the same extent. But the situation is completely different when you treat intracellular bacteria. In this case, we use HeLa cells, tumor cells in which bacteria Staphylococcus aureus was embedded. And as you can see, levofloxacin is not able to reduce of great extent the amount of the column-forming unit of the bacteria internalized in cells. But levofloxacin embedded nanogels have a completely different effect because you have a strong reduction of the column-forming unit. So nanogels can act as a drug delivery system similar to a Trojan horse. But the most important point is the topical application of these nanoparticles, because as you know, Staphylococcus aureus normally resides on the surface of the skin. And when you have a wound, you have a damage of the intact skin, you have an internalization of the Staphylococcus within the body, and sometimes he resides within the keratinocytes. So we treated keratinocytes with Staphylococcus aureus embedded in those cells. And we used two different antibiotics, levofloxacin, as before, and gentamicin. That is an antibiotic that is able, differently with respect to levofloxacin, to enter in keratinocytes and act against bacteria. And after 4 hours of treatment, we have seen that hyaluronic acid nanohydrogels after 4 hours reach the maximum concentration within the cells. We observed that, this is the situation after 2 hours, but after 5 hours, we observed that gentamicin and gentamicin embedded in nanogels reduce of the same extent the column-forming unit of the bacteria. Levofloxacin is not able, when you treat cells with levofloxacin, you have no reduction of the concentration of the bacteria, of the column-forming unit of bacteria. But when you treat the keratinocytes with the levofloxacin embedded nanogels, you have a strong reduction. So it means that the levofloxacin is able to nanogels are able to modify the final destination of levofloxacin. And the idea is that, is reported in this graph, in this cartoon, gentamicin is able to act against Staphylococcus aureus that is normally embedded in lysosome in cells in the specific subcellular compartment, the so-called lysosomes. Whereas levofloxacin is able to act as only at cytosol level. But when you embed the levofloxacin in nanogels, you have, through the endosomes, you have an effect, because there is a merge of endosomes and lysosomes, you have an effect against the Staphylococcus aureus. So by using nanohydrogel, you can modify the behavior of levofloxacin. So it is important because developing new drugs is not a very easy way, because you have to spend a lot of money and a lot of years, because you have to find a new drugs, new mechanisms, and so on. So you have to study a lot and invest a lot of time and money. But by simple using nanohydrogels, it's possible in principle to modify the activity of an existing antibiotic. And we tested also the nanogels on intact skin, human skin. And the results are summarized here. So in intact skin, you have no penetration of the nanogels. When you use a damaged skin, you have penetration of the nanogels. And not like hyaluronic acid, but you have a penetration. It's not very clear from this picture, but the effect is that when you have barrier disrupted human skin, hyaluronic and nanogels penetrate the epidermis and are taken up by keratinocytes. So it can be useful in application. But when you have wounds, the effect is more evident. And you have penetration of the nanogels within the lower part of the body, and in wounds without epidermis, nanogels are taken up by fibroblasts and phagocytic cells. So you can reach different cells at a superficial level of the body, and the nanogels are taken up more specifically than hyaluronic acid, because of the CD44 interaction that is a receptor. So you have an active targeting. And we tested this effect not only by topic application, by also injecting nanohydrogels in mice. And we had a different biodistribution in this case because of different system. And we observed that nanogels were taken up by liver, but also by skin. So in principle, by fibroblasts in particular of the skin. So it's possible to fight an infection due to Staphylococcus aureus by topical application, and at the same time by intravenous injection of the nanogels with the same antibiotic. We are working on this research line, and the next step will be the study of the nanogels loaded with an antibiotic and in mice that are infected by Staphylococcus aureus. So the topical application of nanogels is very effective and is very promising. And we performed other applications, for example, by loading gellan, cholesterol and gela riboflavin nanogels with an anti-inflammatory drug. And we observed that anti-inflammatory drug is able to penetrate to the skin, intact skin, human skin, more efficiently than the normal the products that are present on the market. This is the effect of the plaster, normal plaster that is present in a pharmacy. And so nanogels can act as a penetration enhancer in this case. It is possible also to load natural substances like bicalene. And you can see here, we have no time to describe all the experiments, of course, but just to summarize, you have a reduction of edema and myeloperoxidase and TNF-alpha. You have no reduction of the positive control. Betazone commercial cream or bicalene and bicalene nanogels embedded in nanogels have a very huge very different behavior. So you have a reduction, a complete reduction of edema and the other substances. Nanogels are in liquid form between commas, so you have a formulation that is liquid, but you can embed nanogels also in a normal carbopol gel, a very trivial carbopol gel, and you have the same effect. This is we studied the effect on rabbits by using nanogels obtained by using derivatization of hyaluronic acid with riboflavin, and we embedded in these nanogels derivatives of quercetin. So you have a very interesting results. And finally, I would like to show you, if I have time, do I have 5 minutes? I hope so.
Yes.
Okay.
It's fun.
Thank you. We use the nanogels based on hyaluronic acid and cholesterol for the enhancement of the ocular delivery. You know that many drugs are unable to act also at superficial level of the eye because they cannot easily pass the cornea. And there are some tricks that can be used by the pharmaceutical technologists to improve the permeability of the cornea, but generally there is an inflammation of the cornea of the eye. So this system could be useful. We exploited the permeation enhancement activity of the nanogels to improve the permeation of the cornea in order to reach easily the anterior part of the eye, so the part between the cornea and the crystalline. This is a cornea, porcine cornea. The blue dots are the nuclei of the membrane. And when you treat the cornea, you have the accumulation of the nanogels on the surface of the cornea. But when you treat the cornea with nanogels with some drugs, you have an interesting permeation effect. When you use, for example, an anti-inflammatory drug like desamethasone, that is an anti-inflammatory drug, very hydrophobic, you have, as you can see here, you have an improvement of the amount of desamethasone that cross the barrier. So you have an improvement of the permeation, and in this case, we compare our nanoparticles with the Luxazone, that is a commercial eye drop that is present on the market. And the same effect was also observed for diclofenac, embedded in nanogels based on the hyaluronic acid. And we compare the effect of diclofenac-free, diclofenac present in nanogels at two different concentration, but in all the cases you have an improvement of the permeability of the cornea. But the most important thing is that the effect that you have just immediately after the administration of the eye drops. And just from the first minutes, you can see that there is an effect of the permeation effect of diclofenac, of nanogels in the permeation of diclofenac through the membrane, through the cornea. So, just to conclude, I hope that my presentation convinced you that the 4 keywords can be merged in order to obtain a very versatile delivery system that can be useful for different applications and can be used using different drugs and so on. And of course, I need to thank all the people that worked with me in in the last years, and a special thank to Professor Alike that retired, but he was the mentor of the group in the past many years ago. And Professor Tomasina, Coviello, Chiara, Elita, and Nicole. Elita and Nicole now are in the lab of Professor Leroux in Zurich. And just to conclude, now in this moment I'm here in the Department of Chemistry and Technologies in Rome, in Sapienza. That is a department, and this is the campus, university campus, that is not very far away from Roma Termini, just 20 minutes walk. But if you would like to discover all the monuments and all the beauties that are present in the Eternal City, at the same time, if you would like to enjoy a walk in the polysaccharides and drug delivery world, I invite you to participate to the workshop that will be held in Rome, in my department, at the end of October. And all the information about this workshop are present in the website that is written below, but you can find it in the main page of the NOE. Of course, I've done a lot of all this research. The research is carried out spending a lot of money, and I would like to thank all the people that support the research, but more importantly, I would like to thank you for your kind attention.